So I'm Tom, I'm the Advice and Service Improvement Manager for Epilepsy Action. My role involves managing our helpline team, supporting people affected by epilepsy in the UK. I manage a team of 7. We support people affected by epilepsy via a number of services. So we speak to people over the phone, we respond to inquiries via email, but we've also recently launched a new service, which is a live chat service, which has been really popular since we launched that last year in October 2022. So we've supported about 3,000 people that way as well.
Beddow works as an advice, services and improvements manager for Epilepsy Action. He manages and supports a small confined team of 7 by providing support for their helpline and by giving provisional support to people who call the helpline with how to cope and manage their diagnosis if they are living with epilepsy based in the UK. Epilepsy Action has supported many people who have epilepsy through their different services, including email, phone line and online chat. This is a service which was launched last October, through which they have served around 3,000 people living with epilepsy. What are the underlying symptoms of epilepsy?
Epilepsy is a condition which affects the brain, causing recurring seizures. In epilepsy, seizures are caused by unusual electrical activity in the brain. So there's electrical activity going on in our brains all the time, and in epilepsy, some damage or other problem in the brain happens to interrupt those signals, and that can cause a seizure. The important thing to get across is that epilepsy is a very varied condition. And one thing that we know from speaking to people with epilepsy is that they feel it's really important we talk about the different types of seizures. So the type of seizure that people are most familiar with is something called a tonic-clonic seizure. So that's a convulsive seizure. And that means that when somebody has a seizure, they go stiff, fall to the floor, and then start rhythmically jerking or shaking. And that's the type of seizure that most people associate with epilepsy and what they understand when they hear the word epilepsy. But there's actually lots of other types of seizures as well. There are focal seizures, and those are seizures which affect a certain part of the brain when they start. And because the human brain is so complex, depending on where in the brain is affected, dictates what that seizure looks like. So it can involve various things, including unusual movements, behavior, sensations, emotions, and feelings. So it can be quite difficult to identify because depending on what's happening, that could look like one of any number of different conditions potentially. And there are also other types of seizures as well. For example, absent seizures, in which the person might lose consciousness for a brief period of time and maybe appear to be daydreaming. And then another type that I'll mention is myoclonic seizures, which involve brief jerking movements, for example, of the limbs. So like I say, it is a very varied condition, and not a lot of people in the general public always understand that.
Epilepsy is defined as a condition which affects electrical activity in the brain, and when that activity is disrupted, people who have epilepsy can suffer from seizures. Epilepsy is a varied condition in which everybody has a different experience of epilepsy. It's still important to spread awareness of the different types of seizures. You have different examples of seizures if they do happen to anyone with epilepsy, such as convulsive seizures, focal seizures and absence seizures. The more common seizure type is the convulsive seizure, when they are experiencing symptoms of jerking and rhythmically shaking, and they suffer a collapse to the floor. Focal seizures can affect certain areas of the brain, but depending on whereabouts in the brain is affected, treated, it's difficult to diagnose because the brain is so difficult to understand. For many people, this is due to the complex nature of the brain. Absent seizures are seizures where people lose consciousness for a brief period of time, and it is a varied condition because of the wide range of types of epilepsy and the disparities in the symptoms. Epilepsy is classified as a hidden disability because of the symptoms they develop internally through a disruption in electrical activity generated by the brain. Epilepsy is a condition with variable symptoms, and it is difficult for anyone to characterize the symptoms for anyone who is monitoring a person who suffers from epilepsy. Epilepsy action is operating a course on convulsive seizures, which are more commonly understood by many people and much more straightforward to characterize than the other types of seizures. They have a care message to help raise awareness of tonic-clonic seizures amongst communities to increase their knowledge of epilepsy and how convulsive seizures can impact people. The message represents 4 words from the 4 letters within care. C is for comfort, to ensure that the person suffering from a seizure is comfortable by cushioning their head. A is for action, so you would make sure you do remove any immediate danger to the person going through a seizure, including any sharp objects that may be in close proximity around where the seizure takes place, and that they are safeguarded from potential hazards. R is for reassurance. If you make sure that you are remaining within if you make sure you remain with the person who is experiencing a seizure and wait for them to regain consciousness at place and place them in the recovery position. E is for emergency. If you can alert the emergency services by calling for an ambulance to attend to the casualty and stay with them until an ambulance is at the scene. In the case of someone who may have a convulsive seizure, do not revive them yourself or feel that you should place anything in their mouth. The best course of action to take is to allow the seizure to take place and then permitting a convulsive seizure to take its course. If anyone has a convulsive seizure, there are certain precautions that someone will need to bear in mind. This can encompass elements such as not to move the person once they have gone into a seizure. It's important to restrict the distance of how far you move them dependent on where they have fallen, or if they have fallen in a dangerous place, then you have the responsibility to move them away from the danger but not too far. It's also important to make sure you start to time the seizure, because if it goes on for over 5 minutes, then you will have to call for emergency help by dialing an ambulance. If you are dialing, ensure that you are somewhere where you can get good signal reception in order to complete the call more swiftly, and please remember to stay with the person until medical help arrives. Is it like a hidden disability, or would you class it as something that people can't tell that you have it?
Yeah, absolutely. So, I mean, you can't tell whether somebody has epilepsy just by looking at them. So, yes, in that sense, it is considered a hidden disability. One thing to mention is that most people are able to get full control of their seizures with the right treatment. So it's not even that the majority of people living with epilepsy in the UK will be having frequent seizures. But even people who are having seizures, I mentioned before, it can be difficult to diagnose. There are other conditions which can look similar to various of the different seizure types, and it's important that it is diagnosed by a specialist. So if somebody's concerned about possible symptoms, then the important thing is to speak to a GP. If the GP thinks that it could be related to epilepsy, then they'll refer to a specialist to carry out various tests. And they'll use their experience to say whether they think that it is epilepsy.
From Tom's description, it appears to be that when someone first has experiences of seizures, it's quite difficult to diagnose that a person could have epilepsy because everybody's experiences are different symptoms, and for each person it can be different because of the wide range of types of seizures. It can be challenging for a person to identify and make the distinction of whether or not they have indeed a seizure, or whether it's the fact that they are feeling normal on appearance. Depending on the route you take to getting your diagnosis, it can take longer to diagnose epilepsy. If you have epilepsy, to get your diagnosis, typically you would go to your doctor and tell them about your story of your symptoms you've been going through, and then the next step would be to book a referral to a specialist who can help diagnose your condition and run through some diagnostic tests to determine if you have got epilepsy. You should get your appointment with the specialist within a certain number of weeks. Although the NHS is under some scrutiny for long waiting times in terms of higher volume of appointments and the sheer number of calls that medical professionals receive, there are delays when it comes to getting appointments for specialist referral due to the path that you take towards getting a diagnosis. It can be taking much longer to get a diagnosis of epilepsy because of the uncertainty about what condition you have. Medical professionals can be unsure about establishing your diagnosis and to reach a conclusive decision. That is what can increase waiting times to get a definitive appointment with a specialist to diagnose epilepsy if they can run some diagnostic tests to confirm whether you have epilepsy. What would you recommend people do if someone saw someone having a seizure? What would you recommend they do and what they don't do?
One of the challenges we have with that is, like I was talking about at the start, there are different types of seizures, but we actually have a campaign running at the moment, which is specifically for tonic-clonic seizures, partly because they're the most likely for people to be able to identify, and also they sort of carry more risks than some of the other seizure types too. So our message around responding to tonic-clonic seizures is that we want people to care. So our message is care, and that stands for C is comfort. So if you see somebody having a convulsive seizure, make sure they're comfortable by cushioning their head. Take action by starting to time the seizure, and also remove any dangerous objects that might be nearby, making sure that they're safe and protected. R is for reassure, so stay with them until they come round and be calmly reassuring when they do. It can be very confusing when somebody has this type of seizure. They have lost consciousness, so when they come round, that can often be really difficult. And when the seizure is finished, also put in the recovery position. finally, E stands for emergency. So not all seizures are medical emergencies, but it's important to call 999 if a seizure lasts longer than 5 minutes. The person has one seizure after another without regaining consciousness in between. They have trouble breathing after the seizure has stopped, or they're seriously injured. That's when it's important to call 999. So that's our care message. But there are a couple of also kind of common misconceptions that it's useful to address. So you don't need to do anything to try and bring somebody round out of a seizure. It won't work and it's not needed. It's also important not to restrain somebody because that could injure them or injure the person trying to help. And similarly, you don't need to put anything in the person's mouth to protect their tongue or their teeth. That's something that sometimes people feel like they need to do, but actually you're best off just leaving the person gently cushioning their head and letting the seizure take its course. If they're having a convulsive seizure, then trying to protect their head so that they don't injure themselves, making sure there's nothing too dangerous or sharp nearby. It's important not to move them, generally speaking, but depending on where they've fallen and the dangers around, it's you have to use your judgment ultimately. If somebody's fallen and they're in a road, for example, you may have to move them a short distance to make sure that they're safe. As I mentioned before, it is important to try and time the seizure if you see it starting, because seizures which go on longer than 5 minutes can be dangerous, and they require often urgent emergency treatment to get the seizure to stop. So if it goes on longer than 5 minutes and it's about trying to get emergency support by calling 999 and asking for an ambulance. So hopefully, depending on where you are, you're somewhere where you can get phone signal. I suppose the reassuring message is that most seizures do stop by themselves and they do stop within 5 minutes. So it's not the majority who are going to require emergency support in that way. And as I said with the care message, it's also about just kind of reassuring people that just by stopping, taking some action and being caring and reassuring, that is helping the person too. We want to encourage people to feel like they can help. And often I think people are worried about doing the wrong thing. And that can prevent people from getting involved in helping somebody having a seizure. So I think that's the key message that we want people to take away, really.
How quickly can someone recognize that someone has epilepsy, and is it the case of symptoms being more persistent, or would someone realize it from the outset that he has epilepsy?
When somebody first starts having seizures, as I talked about at the start, it's a really varied condition. So the symptoms they're having could be very different depending on the type of seizure that they're having. And it also kind of depends what their route to getting a diagnosis is. So for some people, they might have a first seizure and then go to A&E or get taken to A&E in an ambulance. Usually what will happen is then people go back to their GP, talk about the fact that they've experienced this, and then get referred to a specialist. So I suppose it can take quite a while for people who have had a first seizure or seizures to undergo diagnostic tests and then have a follow-up appointment with a specialist to understand, what's going on. That should happen quite quickly. So the kind of guidelines around the care and treatment people should get say that those appointments should happen within a small number of weeks. But with all the pressures on the health system at present, we know that often that's taking a lot longer for people. So it can be really difficult for people. Sometimes people might have been given an initial kind of tentative diagnosis. Somebody they've spoken to or seen, say, an A&E or the GP might suggest, oh, well, it could be epilepsy. We think it might be epilepsy, but actually it could be a number of weeks, even months before somebody has actually got the answers that they need to understand what's happening for them.
It's still important to raise awareness of what to do when someone suffers an attack of epilepsy, but how quick do you think they need to be to recognize that somebody's having an attack, or how alert do they have to be if you know they've got epilepsy?
The important thing, if you know somebody's got epilepsy, or if you see somebody having a seizure, is that 5 minutes rule. So seizures which last less than 5 minutes often don't require any emergency medical treatment, and often aren't considered a medical emergency. But seizures which go on longer than 5 minutes may require medical intervention to kind of get them to stop. And if they don't, then that can come with some risks. So I think one thing that we really try and encourage people to do, and is really important, is to start timing a seizure if you see somebody having a seizure. If you know somebody well, then everybody's epilepsy is different, and they may have a care plan, an emergency care plan, which specifies how long to leave it before seeking emergency treatment. And some people as well have emergency medicines that they carry with them, or that somebody, their carer, for example, or if it's in education, and maybe a teacher, if it's a child, will have access to emergency treatment that they've been trained to administer to them if their seizure goes on for longer. So I think, like you're saying, it is important to be alert to that and to act quickly. If you see somebody having a seizure, time the seizure, and if it goes on longer than 5 minutes, make sure that you're seeking emergency support by calling an ambulance.
Through their calling service, Epilepsy Action has advised people to start timing seizures in order to monitor how long the seizure will last, to retain an emergency care plan, to write down how they have been managing their experiences of having seizures, and also record the symptoms they were going through at the start of a typical seizure. Some people may carry emergency medicinal supplies in case of an episode of epilepsy. Even the person's carer would be inclined to have additional supplies of medication to help treat seizure, and that way they could help administer the relevant treatment. However, it is advised to seek medical help and contact the emergency services if you do have a seizure by asking for an ambulance to come and provide medical and professional treatment. Is epilepsy even more common now than more people are aware of they're more aware of the symptoms, or do you think there's still need to raise more awareness of people with epilepsy?
Yeah, absolutely. I think so we've been working on a new strategy this year, and it's involved speaking to lots of people affected by epilepsy. Raising awareness is something that's come out as being continuing to be really important to people affected by the condition. There's still not enough recognition about the different seizure types or understanding around how the condition can affect people. Epilepsy affects around 1 in 100 people in the UK. And you asked about whether that's kind of changed, and it hasn't changed significantly in recent years. It's hard to say whether the numbers that get reported are the true figure, or if, because of things like you say, with people maybe not recognizing that they have the condition, that factoring into how many cases we know about, I suppose. But yeah, there's certainly still lots more work to do to raise awareness, and that's something that we'll be focusing on over the next few years.
Epilepsy affects 1 in 100 people in the UK. Despite its increased awareness, this trend has not gone through any significant change in terms of the statistical data. There is some degree of concern as to what the actual figures are for people who experience epilepsy, and there is an uncertainty of whether they are true reflection of how many people are impacted by epilepsy. However, all things considered, there is still lots of work left to be done on increasing numbers, in raising awareness of the different types of seizures, and in recognizing and distinctly identifying the types of seizures that can happen. Both focal seizures and absence seizures appear to be more subtle in how they impact people. With absence seizures, people are more likely to experience symptoms of daydreaming, and their awareness might be impaired by the impact of an absence seizure. Focal seizures are a different proposition to absence seizures in that the symptoms are more broad and there is a wider range of symptoms for focal seizures, such as plucking at clothing or lip smacking. It's safe to say that epilepsy has many formations, and it's very difficult to make out or recognize each type of seizure any one person may experience. The best option is to seek professional medical advice if you believe that you experience symptoms of epilepsy, and they will feel obliged to recommend you what to do next and follow your doctor's guidance if you are concerned about symptoms of epilepsy. Tonic-clonic seizures are the most easily identified seizure of the many different types of seizures, because they do follow a solid sequence in terms of how it happens. Tonic-clonic seizures are also recognized and are called upon as convulsive seizures when the person feels stiffness. Initially, they start rhythmically shaking or jerking and collapse to the floor. How distinctly visible are the signs and the symptoms of epilepsy for someone on the outside looking in to recognize?
Because there's lots of different seizure types, some may be more recognizable than others. So, as I said, tonic-clonic seizures, which are the type that most people think of when they think of epilepsy, are quite might appear quite recognizable because they follow a fairly set pattern involving the person going stiff, falling to the floor, and then rhythmically jerking or shaking. It's important to say that there can be other conditions that can cause those symptoms as well. So all of this comes with the kind of caveat that even if you see that, it might not necessarily be epilepsy, but I suppose that's probably more recognizable than some of the other seizure types, like focal seizures or absent seizures, which might appear more subtle depending on what's happening for the person. The person might lose awareness, or their awareness might be impaired. So it might appear that they're daydreaming or not paying attention. If they're having focal seizures, they could present with a number of different possible symptoms, which are so broad as to be like quite difficult to characterize to a certain extent. But like I said before, it can involve lots of unusual factors that are influenced by what's going on in the brain. So it could be unusual movement, it could be unusual behavior, automatic behaviors or movements like walking, or sometimes it can involve things like lip smacking or plucking at clothes. As I mentioned as well, it can involve certain sensations, feelings, or emotions as well. So yes, I think that probably talked around that quite a bit, but I think it is difficult to recognize, it can be difficult to diagnose, and that's why it's important that people seek medical advice if they're concerned they may be experiencing epilepsy. And an epilepsy specialist is going to be best placed to carry out the appropriate tests and advise whether that's the most likely diagnosis.
So it's fair to say and safe to say that to see your medical health professional would be the best advice if you think
Yeah,
you've got
absolutely. And I think,
epilepsy.
yeah, absolutely. It's something that we are often asked about on the Epilepsy Action Helpline is, I've been experiencing these symptoms. Could it be epilepsy? And I think we always have to be quite careful to say we know that epilepsy can affect people in these ways, but we can't provide, individual medical advice because of all the reasons that I talked about before, it being similar to other conditions. Really, what you need in order to diagnose epilepsy, the kind of gold standard test is to carry out a video EEG test, which looks at the electrical activity that's happening in the brain at a particular time, whilst also having video footage of the person so that you can see what is happening both in the brain and how they're presenting. But that isn't offered to everybody. It's not always needed for everybody. And so, sometimes a diagnosis is made on the balance of what the specialist thinks based on their experience and the results of the tests they've had.
There are lots of different types of seizures, making it difficult to characterize, although the most common type of seizure is the tonic-clonic seizure. It's still difficult to thoroughly examine the symptoms and pinpoint the causes of epilepsy seizures. Seeking professional medical advice would be the first port of call to get a diagnosis. Most seizures don't have a constant pattern, so they can be more difficult to recognize. The typical symptoms can involve unusual activity in the brain, which leads to actions such as plucking at clothes or lip smacking, or involve a series of unusual movements. So it'd be quite interesting to know how they actually carry out these tests to see if someone has epilepsy and who carries them out.
Some of the tests that can help with the diagnosis of epilepsy include an EEG test that looks at the electrical activity that's going on in the brain. Also, some people are sent for an MRI scan or a CT scan to look at the structure of the brain. That can sometimes identify a possible cause of somebody's seizures, although not everybody has seizures which are caused by a particular kind of piece of damage or problem in the brain. People also will usually have some blood tests, and they're mostly used to rule out other causes of seizures or similar symptoms. So I would say those are the most common tests that people will be sent for, and a specialist will look at the results of those. Also take a really detailed medical history from the person or the person's carers. As much information about what's happened during their possible seizure as well is really helpful. So writing all of that down beforehand, or even taking video footage of what happened, can be very helpful. And they'll use all of that and their clinical experience to come to a diagnosis.
How important is it to raise more awareness of epilepsy and to manage the symptoms if you have the condition?
Yeah, so it's really important for us to raise more awareness about epilepsy, to ensure that people with epilepsy get the respect and understanding and support that they need and deserve. So that's something that will be a focus for us as an organisation over the next several years, working on our new strategy. And we've developed that. We've co-produced that with people affected by the condition, going around the country and speaking to lots of people, carers, people with the conditions themselves, professionals, to find out what the most important things to them. Getting the right treatment to reduce or stop seizures completely is also obviously really important for people. And we provide a lot of advice, information, and support around that and navigating the health system on our helpline. So people can raise awareness in a number of ways. We have lots of information on our website about how to get involved with our campaigns or fundraising. You can do things in your place of work or your school, on your local community. So I'd encourage people to have a look on our website and how to get involved. If anybody needs further information or support around their epilepsy, or they're caring for somebody else, then the Epilepsy Action Helpline is here to support with that. We provide epilepsy-related advice and information via phone, email, live chat, and we'll also respond to some queries that come through via social media too. So you can call the Epilepsy Action Helpline on 0808 800 5050, or you can go to the website and chat with us, or find our form and send us a question.